an endonasal rhinoplasty. I've made one small incision so far in this patient, which is to perform the septoplasty. Septum separates the right side of the nose from the left side of the nose, and you can see where I've made this incision on the inside of the nose, and we'll go back and we'll straighten out part of her crooked septum right here. Okay, this is removal of the dorsal bump here, again all through endonasal incisions, so this is through the intercartilaginous incision. And what we'll do is just go ahead and take down a little bit of the bone right here. Tap, tap. That's it. That removed this little bump here, and now we'll take that little piece of extra cartilage and bone out straight. You can see now that this is much flatter than it was before. Now once the person has had the dorsum removed or brought down, the next step is to fracture these bones here in a very controlled manner to narrow the nose and to close down this little place where you can feel that we took off the bones off the nose. So now we'll make some cuts in the bone that run this direction. This is what's called a medial osteotomy, and then we'll make another cut that starts about here and runs right up here, and then we'll fracture that bone so that it collapses down in. So the medial osteotomy starts here. You can feel, watch where the position is. Okay, and you can see how that narrowed this portion of the nose, and then also closed that open deformity that you could feel there before. So we've taken down the dorsum, we've narrowed it, and now we're going to start working on the tip. We're going to try and give her a little bit more tip definition and rotation to her nose here. And so this is called a marginal incision. We'll make it right here where you feel where the cartilage ends and turns into skin. So we'll make an incision right here. So once we've completed our marginal incision, again, all incisions up on the inside of the nose, now we've got to take this cartilage, pull it out the nose so that we can see it and start to work on it. And so what we're going to try and do is just clean this off and get it to lay a little flatter. So once we've delivered this dome and we've cleaned it off a little bit and we've trimmed it so that it's nice and straight and even, what we're going to do is create a new point. So this is going to be her new tip. That's what represents her tip there. And now I'm going to put what's called a septocolumellar strut graft in place. And that goes just right between the two lower lateral cartilages. So we're going to take it, slip it right down in here. And suture that into place. So now I've put the columellar strut graft in. And what that does is it brings the columella down and pushes the tip up this direction. And we've put a little tiny graft up here called a dorsal onlay graft just between where we took the hump down and where the tip is. And that gave her a straighter dorsum, which is what she wanted. She wanted it to be perfectly straight here, as you can see in the picture. And I think that got us where she wanted to be. So now we're going to close the incisions and we're done. So after the tape's been placed,